Hello, I'm Trudy Loban, and I'm the founder and CEO of Arrhythmia Alliance and AF Association. Arrhythmia Alliance is a collaboration of patients, patient groups, carers, healthcare professionals, policymakers, industry, in fact, anyone and everyone involved in the care and treatment or affected by cardiac arrhythmias, irregular heart rhythm, and in particular atrial fibrillation. I established the AF Association in 2007 after 51% of our inquiries to Arrhythmia Alliance were related to AF. And at that time, there were no other organisations in the world offering information, support, education and awareness on atrial fibrillation. The two organisations work side by side but are completely independent. We ensure that all the materials we produce are approved by our Medical Advisory Board and its members are leading experts from around the world on atrial fibrillation. We also ask our volunteer patients and carers to also read through our resources to make sure that they're in the language for patients and they're not too much medical jargon. We've won many awards for our information and we're now building a video library as well. And more recently, we've launched our first virtual patient educational platform. You can see the lobby behind me. And if you visit that, you will hear from experts from around the world explaining what is AF, living with AF, anticoagulation in AF, treatment for AF, and how better to manage AF. So we offer the information, we offer the education, whether it's in written, whether it's online, or whether it's a virtual platform. And we raise awareness through our Global AF Awareness Week in November and our World Heart Rhythm Week in June. We host many campaigns, all trying to ensure that the public are aware of their heart rhythm to help save their life and in case of AF is detected. Well, 2020 has certainly brought its challenges, and the pandemic, COVID-19, has impacted each and every one of us. But for some, it has impacted even more. Those that are more vulnerable, those that have pre-existing health conditions. So if you've been diagnosed with atrial fibrillation, it doesn't mean to say that you're at any greater risk of contracting it. However, if they do contract COVID, then they're more likely to take longer to recover. So it's had a real impact. Obviously, we're all concerned, but if you're living with a health condition such as atrial fibrillation, your anxiety levels can be higher. At the AF Association and at Arrhythmia Alliance, we saw a threefold increase in the number of inquiries from patients and caregivers, what to do, what not to do, etc. during the pandemic. It's had a huge impact. And on the other side, the impact it's had on our health services. So many appointments were cancelled or postponed, clinics closed. So how do we get our anticoagulation medication? For many, it was a change of medication as well because it wasn't easy to access the different types. And so the concern, the anxiety, the confusion. But hopefully, with our helpline, with our website, and with our emails, and we also have online forums, we've been able to support these patients and their families, because it's really worrying for the carers as well, to explain what best to do. We also videoed a lot of the doctors, the AF experts from around the world, not just in the UK. And all of these are available to download from our website or our virtual patient information platform. And you can actually listen to the doctors, invite them into your own homes via your computer screen, and they can talk you through how to live with AF during a pandemic. The most important thing is to continue with your medications as prescribed by your doctors. And if there is anything that you feel is medically wrong, do not hesitate to phone the NHS. They are open, they are there to help. It is so important that we don't forget about our other health conditions just because of the pandemic. It's also important that we get to know our pulse, to know our heart rhythm. It's so easy. It literally is as easy as 1, 2, 3 to feel the rhythm of our heart. And if we know that, and if it's irregular, we call the doctor. We make an appointment. These days, doctors are calling us because we can't always go into the GP practice, which is great because you can talk to them over the phone or even on video and describe your symptoms. It's vitally important that we detect AF through a simple pulse check. We prevent AF-related strokes by having anticoagulation medication. This helps stop little clots forming, which can travel and cause an AF-related stroke, but it doesn't treat AF, so we still have the symptoms. So it's important that we access the correct treatment to help manage our symptoms. So we must remember, detect, protect, correct, and soon we can live with AF and get on with our lives without it impacting us as greatly as it might do if we don't seek advice. So the COVID-19 pandemic has had a massive impact on the charity. First of all, in March, when we were all told to work remotely and we were all in lockdown, all our fundraising events obviously had to be cancelled. There were no marathons, there was nothing. Even our awareness events, our Know Your Pulse events, had to be cancelled. There was nothing physical that could go on. A lot of people found themselves out of work or being furloughed, so our donations decreased as well. In fact, our income ceased. We qualified to furlough, but I didn't think that was the right thing to do. This is when our patients needed us most, and the families of those who have loved ones suffering with AF needed us most. So we made the very difficult decision to continue. We are a very small team, the staff are committed. So we continued. Our phones didn't stop ringing, emails, the forum, we were inundated with inquiries from patients, from loved ones, from carers, and from healthcare professionals, because they were having to cancel appointments or cancel clinics. And they were so concerned about the patients and where do they turn for information. So working with our healthcare advisory board, the doctors helped us write COVID-related advice and information, and we created COVID-19 pages on our website. If you go to www.afa.org.uk or www.arrhythmiaalliance.org.uk, you will find there COVID-19 information. It tells you if you need an ECG, the various mobile devices you can have or your doctor can prescribe that you can have without having to go to the doctors. It tells you all the various things, and all this information has been approved by healthcare professionals, so much so that the British Cardiovascular Society, Public Health England, NHS England and NICE have all signposted to our COVID-19 pages on the website. So I hope that gives reassurance that the information we are giving has been endorsed and recommended by national bodies. So it did, that the pandemic had a huge impact on us, but we've managed to get through it. We're continuing to get through it. Financially, it's a huge struggle, and we're always so grateful of any donations. We host a patient day every year, and we have hundreds of patients attend in Birmingham. So I came up with the idea we would create our own conference centre online. And this is what you can see behind me. This is our virtual lobby. And just on the 27th of September this year, when we should have been holding a physical patient day, we launched our virtual patient day. You can register, you'll be given a code to access, you can share with family and friends, and there you will find so many different presentations from experts in the UK and from around the world, telling you all about AF, living with it, managing it, treatments, anticoagulation, how to avoid AF-related stroke, how to manage with heart failure, etc. Everything there that you need to know. And we're creating a video library. So I said, you know, although we were faced with a massive problem, we rose to the occasion and we looked for a solution. I'm so proud of our virtual platform that instead of you coming to us, we're now coming to you in your living rooms, where you can learn everything there is about AF. And I'm determined that the organisation will continue And we hope that one day very soon we will start receiving donations and fundraising again. But it's so important that we're here for the patients, the carers, and for our healthcare professionals.